Welcome back to DXB Today. Tonight we are talking about innovation in the world of healthcare, and our next guest set out with a bold mission to make quality healthcare available 24/7 all around the country and make it accessible to everybody as well, 24/7 within 30 minutes. Starting with a team of just 16 members, today it has evolved into a leading home healthcare provider with over 300 professionals. So please join us in welcoming back to the show Pavan Sharma, the founder and CEO of First Response Healthcare. Pavan, thank you so much for being with us.
Thank you very much.
So you're obviously a forward-thinking man. You said people need quick responses quicker. How do you see the landscape of healthcare in the UAE evolving with, of course, your help over the next 10 years?
I think now healthcare is towards getting more convenient, quick, more accurate, and it's because time is changing and nobody has time to waste in these things. So where it will focus is more healthcare getting diverted towards homes and more use of technology. The burden on the tertiary care or the large infrastructures has to come down, and this is how it will be more lean, speedy and accurate for people.
The fact that you can get doctors delivered is crazy.
Yeah, I mean when food can be delivered at home, then why not health? I mean if you look at like people go out to restaurant, used to go out to the restaurant, they need some leisure plus food. So there was a choice to go out. But in health, which is a distress situation, nobody will be willing to go out. I mean, so 100% that can be shifted to homes. But how I divide it is like, you need the healthcare infrastructure for complex procedures, surgeries, criticalities. So everything cannot be shifted, but you look at the primary care. Today, if I ask you like last 10 times when you visited a clinic or hospital, how many times it was a surgery or complexity?
It was last 2 times were both surgeries.
Yeah, so the global number says like, people get 2 to 3 times in a lifetime this kind of situation, whereas they go to the hospital and clinic 4 to 5 times per year. So that means out of 10 times, maybe 7-8 times it is not required, like it can be fixed at home. So the market or the gap is huge, like it will take 10 years to fill this gap. We are just maybe 0.001% what we are doing right now. But I think if you shift primary care to homes, it will be more convenient, effective for the people. At the same time, it will help governments to reduce their healthcare budget, infrastructure budgets, because they will be focused more on the complex side of the healthcare. I mean, so this is the focus for First Response. My focus is that how much primary care I can shift to the on-site locations, be it a home, hotel, office, anywhere. Like look at a situation that I'm in an office and I get a call that my child, fall or something happened. Rather than me traveling to home, what I will do after reaching? If I call somebody who can reach there in 30 minutes, fix it and update me, it's a win-win situation for everyone, like family, the team, me, company, the productivity of the country. I mean, everything put together.
Pavan, if you would allow me to jump in, I just want to go back to what you said earlier on about connecting it to food, right?
Yeah.
So when we're going to have food for takeout, usually it's not the same quality anymore as when you have it at the restaurant, right? So, and there was a time when I did a tele-consultation and they just ended up telling me to go to the hospital. So I want to ask, how do you maintain the quality of the service that you provide when you bring it to the home?
Yeah, so if you look at any patient, like any patient has 2 first requirements. One is somebody should attend. Even if you have a headache, you want somebody to come and give a water or tablet or something. Second is, even if somebody reaches, then how to ensure that you get a right treatment, okay? So our USP from day one until lifetime will remain 2, that reach on time and give a quality treatment. Now how we ensure quality is, we have trust on our systems and protocol, but for the patient's point of view, why they should trust us? We are the first one who got the JCI accreditation. Now JCI is an international body which has accredited 40,000 plus facilities worldwide. So what we follow is the guideline, the protocol and safety guidelines of the JCI standards. What is being practiced in American hospital or any big hospital is the same guideline which our doctors follow. That is one. Second is, this is one guideline part. We as a company is focusing on this, so our doctors are trained. Like for example, King Hospital's endocrinologist comes to our office and give a training. This kind of sessions we do very frequently so that doctors are updated with all the latest thing and they deliver that kind. Third is we also monitor patient-wide feedback. So we have the CSAT program. Every patient after treatment gives the feedback. Our doctors don't leave the patient after the treatment only till the time they are treated. So even if it's 3 days, most of the travelers are our patients. Once they go back to their home country, still they are connected with our teams. Their local physicians are connected with our team. So I mean, our work is not just treating patient, but end-to-end taking care of them.
Incredible stuff.
When you see from customer perspective, what is the group of people who call you? Are they calling for themselves? Are they calling for their parents? Are they calling for their children? What's the demographic of the customers who reach out to you, and then who is actually getting the treatment?
Correct. So always, the concept starts with a small thing and then it takes shapes. Okay. So my identification of gap was like a tourist. If some tourist comes to any country, any city, and they fall sick, what options they have? They don't know about the healthcare facilities. They only have the option to call the reception and get something, or maybe find on Google some clinic. From there it got started that it's not that I have invented something new, but yes, doctors used to go for home visits, but not professionally. So I mean, from a hotel, I will call some doctor.
So it's
this
tourist.
Doctor will come. Yeah, I'm
It's
giving
tourist.
an example of tourist. So I will call a doctor. He will come after 4 hours, 5 hours, or maybe once their OPD is finished. Okay, but that is not the treatment required. So we build it very professionally, where we reach in 30 minutes. So once I reach there, then the treatment is given. After the treatment, my team comes back, gives the complete follow-up, and they are end-to-end. Suppose in case we see that some patient is having an emergency, then we have all the large hospitals tie-up. Like my team transfers the patient to the critical care as well. So that is how this whole process works. So it started with the tourist, but today, so it started with tourist with primary care, but today we do the primary care. We also do the second opinion. We also do the physiotherapy at home care nursing, long term, short term. We have our own first aid training center. We have our own ambulance services, and we are expanding. So what happens?
Amazing stuff.
So patient needs some physiotherapist for his or her mother. So then gradually we started physiotherapy. Now some hotel requires first aid training to their security staff. So we've created a first aid training center.
Understood.
So that is how it gets evolved.